Today, I'm speaking with one of the top psychologists in Alabama, someone who has been selected as a verified expert by the National Professional Referral Network after reviewing hundreds of professionals throughout the state. Dr. Siddiqui stood out for a very specific reason, and we're going to get into all of that today because I think, generally speaking, most people think they know how to choose a psychologist, and we're going to talk about why that may not be the best way to choose a psychologist. There are criteria, and Dr. Siddiqui is going to talk to us a little bit more about his practice and really the best way to find the best psychologist for you. And so we're going to break all of that down. Dr. Siddiqui is going to answer my questions and talk about how he helps individuals, specifically with ADD and other related issues. And so, Dr. Siddiqui, thank you so much for joining me today.
Hi, Dr. Len. It's great to be here.
Many people, I'll call them prospective patients, that are interested in getting help for ADD and again, some of the related issues that are come as a result of that. Once they realize I need to talk to someone, I need help, and they are looking for a drug-free solution. What do you find are the biggest challenges with those patients today? What are you seeing that seems to be a consistent thread with all of those people looking for help today?
Thanks. That's a great place to start. So we specialize in psychological evaluation. So that means figuring out, first of all, if the person even has ADHD is the main place where we want to start. So the biggest stumbling blocks people have, one is long wait times. I hear of a lot of clients who tell me they can't get in to see anyone for 3 months.
Mm,
And the other end of the spectrum is a diagnosis that's given really quick after a 15-minute meeting, maybe a single questionnaire by either their PCP or by a therapist. So in our case, we specialize specifically in neuropsych testing for ADHD. So the process is very efficient. And so that's why we get people in within the first week. And we avoid like very long 2, 3 month wait lists. And we also have a neuropsych test battery, which is optimized specifically for ADHD. So that also makes the process very quick. Because the big issue is if you can't get a diagnosis or can't get in to see anyone, that you can't
mhm.
get the next step of help.
Yeah, it makes sense. So who do you work with? Is there a specific age group, people in a specific age group, or can you maybe tell us a little bit more about who your ideal patients or clients are?
Yeah, definitely. So we really focus in adults, teenagers, and also college students. A lot of people send their young children for ADHD testing. But a lot of people never get that testing, or maybe a teacher maybe once mentioned maybe you had ADHD, but nothing ever came from it. So there aren't a lot of people who specialize in helping older people, college students and above, or even teenagers, get good answers. So people who they've been having struggling getting organized, they can't finish their projects, they're always last minute, or difficulty paying attention at work, or if they have to do a lot of multitasking. So there are a lot of different possible explanations for why a person could be experiencing that. So that's why we have a much broader neuropsych test battery than average. So it can tell someone, are the troubles you've been having in college and or work, are they stemming from something like ADHD, or is there maybe another explanation?
Yeah. Doc, as you know, there are lots of psychologists to choose from. Can you maybe share a little bit more about what makes your approach so uniquely different as compared to other psychologists?
Yeah, well, I'm really proud to tell you that I'm one of the only psychologists in the state that specializes specifically in neuropsychological testing for ADHD with both teenagers and adults. So as a result of my advanced training, I help patients get relief and more importantly, validation using the latest in computerized testing. And we provide a personalized psychological profile based on the testing, and that goes well beyond their diagnosis. It helps people find the real cause behind their symptoms.
Perfect. Can you walk us through how you typically help a new patient once they begin working with you?
Yeah, definitely. So the process involves 2 to 3 appointments. Basically, in the first appointment, you conduct all the testing and it's all done on the computer. It's all done online, and you're sitting with a person who's proctoring you, but we have all the latest computers, and so it provides a variety of cognitive tests. And then you meet with a psychologist for over an hour to an hour and a half, and she gets your full background, all the details of your history, so she can really use the testing data to identify, is the cause of these symptoms actually ADHD or is it something else? And we use something called the ACE protocol that allows us to evaluate someone's attention, their cognitive functioning, and their emotional well-being. And we look at this interdependently on multiple layers. So we really have a chance to get the full picture, the full dynamic behind someone's symptoms. And that's what allows us to provide a personalized treatment plan that works 99% of the time.
Sounds incredibly comprehensive, which I happen to love. Can you maybe share an example, maybe a before and after type example of a patient that came to see you? And you don't necessarily have to go too deep into their problem, but maybe just give us a before when they started seeing you and then how their life improved after.
Yeah, definitely. A great example of how this neuropsych testing can really benefit someone is a lot of times people come in and they say, "Well, I have difficulty paying attention," right? But the question is, "Well, why do you have that difficulty, or what's going on behind things?" So a great situation was an example was there was one client who described falling behind in fast-paced tests during high school. In some classes they did well, in some other classes they didn't do well, and the same happened at college level. And so after some really deep digging, the psychologist discovered it was only in the fast-paced classes that they were falling behind. And so the neuropsychological testing revealed slow processing speed. That came from our tests. So those two things really matched up. Processing speed is how fast a person can think, learn new information, take in information from their environment. So even though this person actually worked in a fast-paced job where a lot was going on, they worked in a pharmacy, but the issue is when they're learning things, they need to slow things down, take notes, have a very deliberate system. And if they're in a fast-paced learning environment, they're probably going to end up missing things. So the truth was they didn't actually have problems paying attention. They had difficulty keeping up, and then you miss things. So that kind of a really useful nugget helped reveal a whole world for them. They said, these are the situations where I can make some changes, and these are the situations where I can thrive. Once I learn something, I have no problem going fast. So that's the kind of clarity that people can get with detailed testing.
Hmm. Can you share a little bit more about what you may have experienced in your background, or again, some of that specialized training that makes you uniquely qualified to work with people or patients with ADHD?
Yeah, definitely. So I've had specialized trainings in neuropsychological testing specifically for ADHD. So there are a lot of different things that people get neuropsych testing for. They might have a car accident, they might be getting older in age. And so it's really important to find someone who specializes in interpreting the same different tests that might
Hmm.
be used for different people for your specific situation. For example, even something as simple as an IQ test, what you take from the results depends a lot on what you're looking for. So that's why our test battery includes a lot of additional cognitive tests that aren't provided in other clinics because they're giving sort of a standardized boilerplate test battery for ADHD that they maybe read about. But we have customized tests that look for specific cognitive functions to figure out how each aspect of a person's mind are operating.
What do your patients say they love or appreciate most about working with you?
Well, our patients mostly rave about the level of detail in our process. When they see the results in our report and they see so many different neuropsychological tests, they get very excited, especially because we have organized it in a very graphical, user-friendly way. Traditional psychological reports are 20 pages long. Nobody wants to read them. Even the doctors don't want to read them. So ours is all graphical. It uses colors, it uses charts, and people can understand very clearly what their strengths are, what their weaknesses are. Similarly, the clinical psychologist spends an hour to an hour and a half hearing about each individual's personal story. That's a lot more detailed than a PCP doesn't have time for that. A psychiatrist often doesn't have time. They usually get 10 minutes, maybe 15. So you get the chance to give in detail how the symptoms have affected your life over starting from a young age. And people really appreciate the time they put in and they see how they tease apart all the different aspects in the report.
What do you enjoy most about helping people?
Well, I like most when you see the clarity and the relief that people get when you give them this kind of explanation, because a lot of times they've had symptoms their whole life. And either they never got any answers, or sometimes they got negative feedback. Why don't you pay attention? Why, if you just tried harder, you could have done better. So when people start to see there's a light bulb moment, they say, you know what? I was working really hard, but there was this one aspect that I didn't know about myself that now that I have this answer, I can make some small tweaks and my life can be a lot better.
Yeah. For before we wrap this up, for someone that's looking for a psychologist, that's looking to get help for ADHD, can you maybe just share a couple of things that they should look for when choosing to work with or hire a psychologist?
Yeah, I would say the most important thing is a psychologist who's going to examine all potential explanations and not just jump to ADHD.
Hmm.
Because unfortunately, there's a lot of research that shows that ADHD is one of the most overdiagnosed disorders in all of mental health. Anytime somebody says I can't focus, they just slap that label, especially on younger children. Um, and the reality is there's a lot, especially in adult situations, there's a lot of potential causes. Sometimes there's trauma in someone's background. Sometimes they have difficulty with their memory. There can be a lot of various issues that are making a person feel like they are not paying attention well. And so finding a psychologist and a clinic who's going to take the time to examine each aspect from a testing situation and then give them the as long as they need with a psychologist to really tease out things. Then they can be certain that if I either get the diagnosis or if you don't, if they give you a different explanation, I never hear from any patients, well, I really feel like I have ADHD. I think you were wrong. They say, oh, I'm glad you explained why it's this other thing because when it's explained clearly and they feel like there's a lot of evidence, they really feel happy with the end result.
Perfect. Well, Dr. Aman Siddiqui, on behalf of the National Professional Referral Network, I thank you for taking the time to share all of that insight today about how you work with people and help people with ADHD. We love the unique and proprietary process that you have. And if you're watching this and you're considering hiring or working with a psychologist specifically for ADHD, we want to encourage you to reach out to Dr. Siddiqui and with any and all of your questions. And I know he will be more than happy to answer all of those questions for you. For now, have a great rest of your day, Dr. Siddiqui. I hope we get the chance to talk again.
Bye. Thanks for having me.